Hey, everybody, it's Peggy Hasenauer from the Kovler Diabetes Center at the University of Chicago. We have had the opportunity over the last couple of weeks to interview some amazing people, patients, physicians, scientists, and today we have with us our patient and friend, Samson Pollak. Samson, say hi.
Hi, everybody. Thanks for having me, Peggy.
Of course, Samson has been a longtime friend, as his parents have been. And I think what's wonderful about you, Samson, is you have experienced your diabetes journey just over the last few years. And so I think it would be cool for you to share with those watching this a little bit about you, when you were diagnosed, and where you're at in life these days.
Yeah, thank you, Peggy. I was originally diagnosed 19 years old, and I was in my college fraternity when I found out in my beginning of my sophomore year. So it was a pretty interesting experience just being hit with the disease. But really, speak of the devil, there's my pump.
Okay. Hey, that's okay.
Yeah, I
Okay.
mean, it's again part of the life of adapting, but really it was a journey. It was through like a lot of hard work and a really amazing support network through my family and friends. I was fortunate where I didn't really have to take a break from school and I was able to keep on going. And really, I've had really the privilege and benefit of being able to experiment with a lot of different products that are available for the treatment and aiding of T1D from some insulin pens. And now, as you could have heard, from a pump.
Awesome. That's great. And you're fairly new to the pump, is that right?
Yeah, so I began on the pump officially in October. So
Fantastic. So tell
yeah.
us what your experience has been. You spent a couple of years on utilizing insulin pens. What's the conversion to the pump been like for you in terms of managing the rest of your life?
So really, it made it so much easier. I mean, for a couple of different ways. One, just the constant injection from pens. Like I've always had a fear of needles, so like
Uh-huh.
again, just kind of doing it over and over was a little bit tedious. Versus this is more convenient and it just kind of it drips at its own pace. I have to think about it less. And additionally, there's not really that risk, of like, oh, where'd the pen go? Did I leave it somewhere? And so there's also
Absolutely.
that huge benefit gain as well that I think is, and really you adapt to it pretty easily as well. So it really just becomes more of an extension of yourself than just kind of
That's
something foreign that you're carrying around.
that's great. And you've been managing your diabetes in the context of college life, which is not easy. You're a student at Indiana University, graduating when? Not this year, but next year. Is that
No,
correct?
so I was supposed to graduate May 2020 this
Holy
year.
cow.
Yeah.
Okay. Wow.
Yeah. So my graduation got canceled, which is always all my friends are
Oh,
talking about. Not to add a
I'm
little bit of
sure.
salt in the wound, but it was our bicentennial for IU too. So we were the 200th class, and they're not able to celebrate. So
I think that's been such a disappointment for so many people, and you have to try to figure out how to celebrate with your friends, how to manage the context of your own life, how to think about next steps for you. Um, so, speaking of which, you're back in the western suburbs of Chicago, or are you in Indiana right now?
so no, I'm actually up in Michigan. We have a family home up in Ludington, Michigan.
Great, and so you're there with your family.
Yep.
And how has your diabetes management changed or not changed since you've come home?
So interestingly enough, for me personally, I think I'm actually managing it better. And so just
Yeah.
kind of looking at my numbers and analyzing those numbers, just for a couple of reasons. One, just kind of being inside, I've really established a pattern. So
Hmm.
I've kind of been like eating more of the same things. I've been exercising consistently at more of the same times. So really, I'm able to calibrate like what I should dose and like what I'm eating and what I should dose versus college life, which usually tends to be a little more variable. You're going here and there, and you're not really sure what's going to happen next. So
Sure.
in that aspect, here I'm gonna see. I think he beeping. I want to see the message this thing is giving me.
Hey, it's all good. Read the message. That's your job.
Yeah, no, exactly. Let's see. Oh, because I hopped in the shower, I've had to turn the resume back on. So
Okay,
he's
hit
yelling.
resume. There we go. Thank goodness it beeps.
Exactly. So in that sense, it's become my numbers overall have been better and really just kind of in a less variable environment.
That's really cool. I think that you're also experiencing diabetes perhaps for one of the first times in the context of kind of a family environment versus, although in some respects it's sort of interesting and parallel that you lived with people before, you're living with your family now. Um, And I'm sure it's hard for every college kid to be home right now. So, your parents, I know, give you a lot of autonomy. And what are you thinking about in terms of next steps, not only for your diabetes management, but for your life after graduation? What do the next few months or next couple of years look like for you? What are you working on?
So as of right now, I mean, I accepted a Master's of Science of Information graduate program. So I'll be doing that next year again at Indiana University. It's a 1 year program.
Wonderful.
Yeah, and I'm very excited about that. And so right now, really the big thing I'm wondering, just kind of working on is what my schedule is going to be, because there's some talk. I know the online class, there's going to be online during the summer session, but just kind of what the fall is going to look like is kind of up in the air. So I'm kind of waiting to plan around that whenever that decision is made. And really, I mean, just kind of after graduation, it really is, I mean, play it by ear. I think if this whole COVID-19 situation showed anything, it's kind of man plans and God laughs.
Yeah,
So,
very interesting. Very
yeah.
interesting. Tell me what your perspective is about COVID-19 and type 1. We've talked to a couple of other patients of ours who um, have expressed the same concern I have about the way the media portrays risk of diabetes in COVID-19. They often don't express that it's our type 2 older adults that are more at risk than someone, say, type 1 who has good control. So, what's your perspective on it, and what have you talked to your friends about and family?
See, it's really interesting because because I've had some family members and some friends being like, "Oh, like if you get sick, it becomes like a real problem." I'm like, "Well, like hang on a minute, guys. I'm
Right,
not
right.
exactly how that works." And I feel in my perspective, it's just kind of blanketed terms. People are like, "Oh yeah,
Correct.
that disease, like that's the effect." But really, I mean, again, I didn't really know much about type 1 diabetes until I got it and really looked into the science. And you're right. It is, I mean, the people who mismanaged it aren't really consistently using insulin, have had it for like multiple years. I mean, and then the difficulty with diabetes is just not so much that, yeah, your immune system's less. It's just, it becomes more difficult to dose and change the site. Maybe you like keep it on. I mean, it's the mismanagement. But I mean, really, it's just kind of educating people one person at a time, just those around
Sure.
you.
No, I appreciate that. And I think that part of the reason why we're doing these videos is for you to share your experience. And to your point, if you have a physician that you're in contact with, if you're managing your insulin and your blood sugars and you're being consistent, um, there's a very low risk, in fact. And having diabetes alone doesn't put you at risk. It's, again, the older adults with type 2 who maybe have a multitude of health issues around diabetes that really causes the problem. Tell me a little bit about your um, thoughts or perspective on a college student who's fairly newly diagnosed now in his home. Do you have any words of advice for them? I think there's a lot of people being diagnosed as we speak who are now home with mom and dad, 18 to 22. What would you tell them?
Well, really, it is quite fascinating because I think a lot of us also, it's thing I find it most similar to is when a new college student who doesn't have T1D comes home and they have to like reintegrate back into what home life means.
Hmm.
And
Hmm.
it's like very, I mean, there's conflicting viewpoints like autonomy versus like the family unit and like what does that all mean? And really, I think when it comes to diabetes, a lot of it's the same because I mean, there's two conflicting lifestyles. The patient or the individual with T1D says like I got this, hold on, but the parents of course out of love want to like help and be part of it and just are really looking out for your best interest. So
Sure.
really, again, like T1D, it's like finding that new normal, finding that balance, and like giving enough time and like just communicating and like expressing how you feel but not blaming it. Really, I mean, eventually you'll kind of come into a new normal where really you'll feel comfortable and you'll get adjusted to being at home again, and your parents will understand and start giving you more autonomy. And eventually it will be rough at the start, but eventually you'll find the new normal.
I think that's true for many college students who are home who don't have diabetes right now, right?
Mhm.
Mom and dad are worried about what time they're getting out of bed, and they're worried about what they're eating, and they're worried about whether or not their room is clean. And you're like, holy cow, like I was living on my own until a couple of weeks ago. But I think you bring up a really valid point that I think parents have paid so much attention and such an important pivotal role in their child's diagnoses that it's hard to sort of figure out what this balance is. So I think those are great words of advice. Um, Samson, you've been a huge champion for diabetes and certainly for the Kovler Diabetes Center. You and your entire family supported an amazing gala that we had. How about that? A couple of weeks before all this occurred,
You know, we
you
keep
know,
talking about that. We're like, I mean, if that was a week later, we would be
isn't
running.
that amazing? Yeah,
Yeah.
amazing. We raised almost $1 million in one night, greatly in part due to your family, Samson, and the outreach that you did. But boy, did we luck out with that. And I think that what you and your family have done to support Kovler is based on the role that Kovler plays in your care. So, how have you been communicating with Dr. Phillipson or your team, or are you about to set up a virtual visit? We're sort of learning how to do this both on both the patient side and the physician side, and so I'm curious if you've had a conversation with Dr. Phillipson yet, or our team.
So right as of right now, I haven't exactly scheduled a visit to come in because with everything, like my numbers are great. I haven't ran into any
Awesome.
major issues, and so again, just kind of waiting a little bit longer, postponing my appointment. But I have reached out to both Amy and Dr. Phillipson, and again, it's like they're the dream team. It's like nothing changed. They still get back to me. They still message. I mean, and it's not just like, oh, yes or no, or this is how you do. I mean, it's paragraphs with explanation, other resources. I mean, I couldn't ask for anything better, honestly.
I I'm thrilled to hear that, and I think what often people think is that they can't communicate with their physician right now. So we're doing a lot of virtual visits. So even Dr. Phillipson's doing virtual visits, but I think patients feel much like you do. Of course, they don't want to come into the clinic right now, but they think, well, I don't want to bother them. And I think you bring up a really valid point that it's okay if you have a question to reach out to your doc. They will get back to you, or frankly, they should get back to you. So I think that communication piece is something you bring up that a lot of people, and certainly college students with T1D, should be doing. Um, Samson, I can't thank you enough for your time today. I wanted people to get to know you and get to know a little bit about your experience with diabetes. We hope to do a part two and maybe even a part three with
Yeah,
you and your family.
always a part of that. Hey, and if you want to hear a parent's perspective about it, I'm sure my parents would love to give their opinion because I mean, again, I think a lot of kids my age need to know, and I'm reluctant to say, but the parents are learning too. It's not just
Absolutely.
it's not just the individual with T1D, but I mean, it affects the people you love.
Absolutely. Absolutely. Samson, it's been a pleasure talking to you today. I think you've shared so much with us that so many people who watch this are going to benefit from. So have a great day, and we will be in touch soon.
Sounds good. Thanks, Peggy. Bye.
All right. Thanks. See ya.